I would like to welcome everyone to Yorkville University and Toronto Film School's Ask an Expert series, giving students, staff, and faculty an opportunity to hear from and to engage with a different expert each week at this time. I'm Dr. Deirdre Pickrell. I'm the Dean of the Student Success Unit, and our unit covers all of Yorkville University and Toronto Film School, all programs, all students, and I'm thrilled to be able to bring this series to the school community. Please use the Q&A button at the bottom of your screen to submit questions. We will absolutely get to as many as we can. Today, I'm thrilled to welcome Dr. Kimber Shelton, and we'll turn things over to Shauna Thompson, our Director of Mental Health and Wellness, who will open this session and introduce Dr. Shelton. And Shauna, take it over to you.
Thank you. Hello, everyone. Welcome to our Ask an Expert session today. We have Dr. Kimber Shelton. She is a licensed psychologist and owner of KLS Counseling and Consulting Services. She provides counseling specializing in the areas of trauma, cultural diversity, and relationship concerns. Since 2015, Dr. Shelton has served as an adjunct instructor in Yorkville's Master of Arts in Counseling Psychology program. Dr. Shelton is an international speaker, providing professional trainings and workshops to both businesses and organizations. She has over 20 publications, including the upcoming release of a handbook on counseling African American women, psychological symptoms, treatments, and case studies. And maybe towards the end, she might be able to tell us a little bit more about that. Dr. Shelton previously served as the co-chair of Texas Psychological Association Diversity Division and as a committee member on the American Psychological Association Committee on Sexual Orientation and Gender Diversity. She earned her PhD in counseling psychology from the University of Georgia and MS in mental health counseling from Niagara University. So we're very pleased to welcome Dr. Kimber Shelton.
Thank you, Shauna. Thank you for that very warm welcome. And I'm happy to be here talking about, well, not talking about COVID, but being able to talk about ways that we can cope through what we're experiencing, and specifically some of the experience that ethnic minority and international students might be facing with what's going on in this global pandemic right now. So just give me a moment. I'm going to pull up a PowerPoint to kind of work through our presentation today. Okay. So we're going to be talking about ethnic minority stress and managing self-care during COVID-19. And for ethnic minorities, we're not different from everyone else in terms of coronavirus is having a huge impact on us mentally, physically, psychologically, our health. So again, different from no one else, ethnic minority and international students are having to think about things related to prevention of corona transmission, thinking about symptoms. So certainly everyone is impacted right now about what's happening in the world and what the influences are now and in the long term. So rightly so that many of us are feeling more anxious and more worried and concerned. And then our lives have changed. So fortunately for many students, classes have been online, but even if your classes are online, that starts to look different too, in terms of your classes may be online, but now there's also children at home while you are taking your classes. There might be a spouse at home, there's family members at home, and I might have been able to go to the library before or go to a coffee shop. These things aren't available anymore. So just our day-to-day lives have changed while we're still trying to keep some sense of normalcy. So everyone is just really struggling right now. And it makes sense that with this global pandemic, there's more fears, anxieties, and worries for everyone. So everyone has these struggles, but there's ethnic minority stress that is also going to be having an impact on individuals who have marginalized identities, international students. The ethnic minority stress is mental, emotional, physical, psychological stress associated with having a marginalized identity. So what that means is just simply by identifying as an ethnic minority, you could be carrying more stress within your brain, your body, your nervous system, because your identities might not always be acknowledged, respected, and because of the systemic and historical treatment that the minorities have experienced, that stress mounts within us. And that stress is going to originate through cultural conditioning. So some ethnic minority communities, we might hear things like, you have to be strong, you have to work twice as hard, you can't be weak, it's not okay to ask for help. So those cultural and conditioning messages, they're based in resiliency. You see great strength coming from marginalized communities, great perseverance, um, great ability to resource and cope. But then there's a cost to that too, because we can't be strong all the time. Sometimes we do need help. And if we're struggling, we might not know what the resources are for us. And the idea that asking for help is a sign of weakness that ends up hurting us in the long term because we're dealing with these stressors in our bodies and not having any real way to release them. Ethnic minority stress is associated with generational trauma. So won't go into this very in depth, but there's lots of biological and organic research that shows that we pass stress and anxiety through our nervous system. We can pass that on in utero. So for communities that have experienced mass traumas, such as residential schooling, slavery, refugee, those stressors, they are transmitted and they're carried in our body, and they can be passed on from generation to generation, which can put some ethnic minorities at a place for being predispositioned for greater anxiety or mental and physical health related issues. So we're carrying that ethnic minority related stress with us as well. Another common experience ethnic minorities have is the experience of microaggressions. So microaggressions are different from overt or big signs of racism or discrimination, and are more covert, hidden, innocuous messages that are transmitted, a negative message about your cultural identity. So a microaggression that a lot of ethnic minority, particularly Black people, might face is, you're so articulate. Well, yes, I have a PhD in counseling psychology. I do know how to speak well. Thank you for that. Is that a compliment that I'm articulate, or would that just be something that's expected? What does that really mean? Or a common microaggression that Asian descent people may hear is a question, where are you from? I'm from Alberta. Where are you really from? Are you asking about my ethnicity? Because that question, I just answered that, but so when we have those questions continually, we start to feel like a foreigner in our own land, or I'm always different, or I might not be as Canadian or as American as you are. So microaggressions on their own don't tend to be hurtful. What makes microaggressions dangerous is the common occurrence of them. So hearing that question, where are you from, on a daily basis or a weekly basis or just over the years, having questions about your intelligence level based on your ethnicity, when we are perpetually hearing these sorts of things, it has a negative impact because it's hard to know what to do in those moments. Is this actually a microaggression, or am I taking this the wrong way? Did you really mean that, or you didn't mean it? And do I say something? Do I not say something? So while that other person has just kind of moved on with their day and is doing other conversations, ethnic minorities, we're still holding that stress of that conversation. So we might not be as present as a student or as present as an employee. We're not as present with our families because we're carrying that psychological toll that's related to being an ethnic minority. And then ethnic minority stress is associated with inferior and culturally incompetent treatment. So there is documented history of ethnic minorities not getting culturally sensitive care, both mental health wise and physical health wise, and then just more globally within our system structures. So again, like the experience of residential schools that was culturally insensitive. There's research that shows when ethnic minorities are talking to psychiatrists, the psychiatrists are oftentimes overdiagnosing, underdiagnosing, or misdiagnosing ethnic minorities, which already feeling concerned about seeing physicians because of the historical issues related to the sort of healthcare ethnic minorities have experienced, feeling hesitant to get care. And then when we are getting care, we may be getting inappropriate or unhelpful treatment. So not only are ethnic minorities having to deal with the everyday stressors that everyone else is experiencing with coronavirus, it is then intersectionally impacted and doubly impacted by race and ethnicity. So there's some significant mental health consequences to that. And there's no surprise then that ethnic minorities are going to be reporting things like greater levels of anxiety, worry, fear, depression, and having more health consequences. So higher blood pressure, we might see more obesity, we might recognize there's more experiences of heart palpitations and those sorts of things. Okay. So then specifically related to COVID-19, right now, ethnic minorities are facing more increased discrimination and biased treatment. Then unfortunately, we can turn the news on and see example of particularly Asian descent, Asian American, Asian Canadians being impacted by stereotypes and xenophobia. So when pandemics happen, increased xenophobia and fear are not uncommon. We see this with any sort of pandemic, that fear makes a specific group become targeted. And right now, the experience of people who are Asian, we see an increase in that. So there's been reports of Uber drivers not picking up Asian people. And in Brooklyn, just 2 days ago, an Asian man was physically assaulted because he was wearing a mask out in public. And that's concerning. So it's a different level of stress, even if it's not impacting you as an individual, knowing that your community is impacted creates additional stress that we have to cope with and deal with. We know that the healthcare consequences are disproportionate. So an example of that for African Americans, they are disproportionately dying from COVID, even though our percentage within the US and Canada is quite small. So an example, in Milwaukee County in Wisconsin, about 25% of the population is Black, but they account for 75% of the deaths from COVID. In Chicago, 70% of people who are dying from COVID-19 are Black or African American. So we see that there's certain groups who are just not able to get the treatment or the resources that they need. Then related to that, is that there are fewer treatment options, there's fewer resources, that much of the research is based on majority population. So ethnic minorities and international individuals might have a hard time finding those supports and resources that they need. And then there's just a psychological strain that if you have family or loved one, people that you care about who are somewhere else in the world, you can't get to them. So you might be able to access them through virtually, but if needed, it's there's a psychological wall in being able to actually physically be able to get to someone. So that causes some stress too on our psychology. So we see that, again, ethnic minorities and international individuals, international students are going to be dealing with all those fears and anxieties related to COVID, but then we just see with that intersectionality that there's higher or mounting stress related to your ethnic minority identity, which places ethnic minorities at a greater risk for health and mental health related concerns or issues. So let me just pause there to see if there's any questions or feedback that have come in yet.
Okay, so we don't have any questions that have come in yet, but I would ask that you continue to discuss some of the challenges that are unique, I guess, to international students and ethnic minorities during this time.
Okay. So some of the challenges would be where to go, what do I do with this information, where to get help with that, with these challenges. So I'll talk about those challenges as then I'm talking about some of the resources. Is that all right?
Oh, yes.
Okay. Okay. Yeah. So thinking about ways that ethnic minority individuals and international students can cope during this time. One is this, just self-awareness. So dealing with family, dealing with your own health, dealing with I have to turn these assignments in, dealing with I'm still working, how do I get all this in? We can lose sight of just even attending to ourselves. And particularly if we're coming from a culture that may be more collectivist and we're focused on the larger culture versus our individual selves, it can be hard to ask those self-reflective questions. And if we've been culturally conditioned to just work and to go and be strong all the time, we might not be as strong in being able to sit back and be present with ourselves. So being able to do that check-in, where is my battery level? How am I feeling right now? Acknowledging that this is not an easy time, I might not be at 100%. So encouraging you to ask yourself questions like, how am I feeling? And that is mentally, where am I? Physically, where am I? Emotionally, where am I? And depending on who you are and what your needs are, you might be asking yourself spiritually, what are my needs right now? Where am I in terms of my coping relationally, professionally? Um, then asking to that too, what are my needs and how can I get those needs met? So first, just by doing a check-in of where you are so that you can have a starting marker for getting those help or those services that you need. And then we want to have realistic expectations. So we want to make sure that our goals are attainable and doable. I've seen a lot of webinars and seminars on productivity during pandemic and moving forward while we're in Corona and taking yourself to the next platform during this pandemic. And I say, well, more power to those people. They must not have children, or they must have a beautiful office somewhere, or when they were self-isolation, wherever they were self-isolated, they have all these resources available. So great if you can be productive during this time. But that with this pandemic happening, and even if our lives still on the outside look the same, internally, we might not have that same level of productivity and motivation. And being okay with that. So, as much as I see being productive during this, I also see a lot of information that says recognize what your limitations are, to be able to be gentle with yourself, that we're not operating at 100%, and to be okay with that. And we're being able to manage our dual realities. So we can be grateful and appreciative for our safety, for our security, while still being worried and stressed about what might happen in the future, holding these multiple realities. I can still do what I need to do as a student and a parent, while it's really hard for me to do what I need to do as a student and a parent. Both of those realities exist. So having realistic expectations, being able to manage our dual realities, and recognizing that we might not be at 100%. And we want to practice good self-care. So clinically, when I'm working with clients, oftentimes they are coming in with these big questions and important questions of who am I? What's the meaning of life? What is my purpose? I say, well, it's going to be hard for us to find out what your purpose is if you're not eating, if you haven't slept, if you're not doing these basic things to take care of yourself. To get to who am I, and you're not even eating regularly, it's going to be hard to answer that question. So during this time, we want to make sure that our basic coping needs are taken care of, that our diet and nutrition, we're paying attention to that, where we're eating regularly and we're aware of what we're eating. And so when we're feeling stress in terms of our nutrition, oftentimes people will find that they're eating more than they want to be eating and doing that emotional eating to take care for yourself. Evolutionary, that makes sense. When we're experiencing stress in our body, evolutionary wise, our body is responding to an environmental stress. So we can think back to hunting and gathering days. If you were feeling stressed, it was because a famine has hit, or we're about to have to walk 500 miles to get to the next gathering place. So it made sense for your body to crave high-fat foods and to store them because you were about to have to do this great journey. But now when we're feeling stressed and we're not walking those 500 miles, we're feeling stressed and we're getting our bag of potato chips and then we're sitting on our couches, we're not going to be using that energy the same way. So thank goodness our body is still activating that stress response the way that it needs to, but then we have to be conscious of what that stress is actually communicating to us and still self-regulating our diets. And then we can go on the other side of that, where when we're feeling stressed, we don't have an appetite, we're not hungry, and we're not eating. But even though we might not be physically feeling hungry and our body is not sending those hunger cues to our stomach the way that it needs to, still our brain needs that nutrition to be able to function. So we need to be eating regularly, even if we might not physically be feeling hungry. We want to make sure that we're maintaining a helpful sleep schedule, going to bed at the same time, making sure that we're getting that deep restorative sleep, doing things like being able to exercise, get outside, and paying attention to our grooming. Self-care also.
Dr. Shelton, you started to go into one of the questions that just came up, which was what would be important for a daily routine? And then there was another question here asking about mental health supports. So for people who may be particularly resistant to counseling, either because of past experiences or the way that their particular culture views counseling, how would you suggest accessing mental health supports?
Okay, so this is the daily structure part of it. I think that can be very personal, that some people having a structured day works well for them. I've seen all these beautiful schedules on Pinterest and how to regulate your day and hour by hour. And if that works for you, great, do that. But then for other people, a very rigid schedule might not be what's going to work for you during this time. So having flexibility in that schedule. But some common things that would be in any schedule that's regulated or unregulated is your sleeping, going to bed at the same time, trying to wake up at the same time, making sure that you're eating through the day and that you have some breaks between your working and your family time. But making a schedule that makes sense to you. And then during that time that we're practicing that good self-compassion of being kind to ourselves, saying kind things to ourselves, if we can find those breaks, taking those time, that break for ourselves. And I will talk about more mental health resources. So because of time, I'm just gonna move a little bit quickly through these things that we can cope by having and building our sense of safety. So identifying allies if we're having a hard time advocating for ourselves, or people that have a shared commonality with us, we'd be reaching out to them. Paying attention to how much media coverage we are in and making sure that we're getting our information from reputable sites, and being able to limit our media too, that we don't have to be 24 hours into COVID, and recognizing what your own safety needs are. And if we are experiencing discrimination or bias treatment, that first we just name that wasn't okay, or that was xenophobia, that was racism, so that we're not internalizing those experiences or those messages. But we're not going to own that. And you make decisions about what you want to do with that. But that's the start of not internalizing someone else's discriminatory or biased behaviors. And social distance does not mean that we are socially isolated. So during this time, we're still very much reaching out and connecting with others, whether it be family, friends, acquaintances, other professional networks, that we are staying connected to our communities, and as well as other people supporting us, we're supporting others. And then we're seeking support within the university. So this is the time to be asking many questions. What is the policy? What changes have happened? Talking to your counselors, talking to the dean, talking to your instructors, and being able to advocate and ask for things like extensions. If you're doing a practicum, can my time be extended? Seeking flexibility and adaptability in your assignments. I'm finding in general that Yorkville, in particular the program I in, is very understanding of students' struggles and are very considerate about not only you as a student, but who you are as a person, and making sure that you stay well and healthy and being flexible and figuring those things out. And then, yes, we need culturally competent care too, so that we're seeking mental and behavioral health care from competent professionals, which means then we can go specifically and look for therapists that might be within our community, and we might feel more comfortable as a starting point there. So there's actually a growing body of platforms, and most of these therapists are offering virtual therapy now. So there's specific resources or therapy sites for ethnic minority individuals. One I think is, that's a resource I commonly refer to is therapy for Black girls. There's also a resource for religious minorities. There's where you can go and find Muslim therapists, Buddhist therapists. So going and finding therapists where you feel like you might be most comfortable with, and then being able to ask your therapist questions too, like, what sort of training do you have in cultural competence, or what experience do you have working with people with my community? And if you're feeling like the therapy is not a good fit, that's okay. You change and you find a different therapist. That's all right. That fit, that relationship is really important. So using one of those specific resources, and regardless of the background of your therapist, being able to ask questions to make sure that you feel comfortable working with that person and that they're going to respect and understand that minority stress and culturally conditioned messages that might be influencing your mental and physical well-being right now.
Okay, thank you. One last question. So in the midst of all of these challenges that you've outlined, what is just some advice you have on how people can avoid becoming discouraged?
I think first is this, my goodness, this is just overwhelming. This is a lot. And day to day, things are changing. Hour by hour, things are changing. So we're not going to feel like ourselves. We might not be feeling like ourselves for a while. And that's okay. That discomfort, that can be okay too. And it doesn't mean that we're in a wrong place, we're in a bad place, that we are doing the best that we can in dealing with what's going on right now. And I want to think specifically about ethnic minorities, that historically ethnic minorities have experienced many pandemics and lots of different persecutions. And as a people, we have survived this. So we're going to make it through this too. We don't want to keep having to make it through things, but we have that resiliency within us to persevere and survive. But different from historically where things have been in the past, there are many more mental health and physical health resources. So making sure that we are turning to others and using the supports available to us.
Okay, thank you very much. And if there are any lingering questions, you can all contact Dr. Shelton right here at the email that she's provided. That's kshelton@yorkvilleu.ca. And I know our time is finished, but I'd like to thank everyone for attending, and thank you very much, Dr. Shelton, for that excellent presentation. I hope that everyone found this information helpful and that there are some tools and resources that people are able to use during this time. Thank you, everyone. Take care.
Thank you.